disrupts sleep. So what's on your mind?
I just thought when you first said that, you were going to say, I was in the hospital and I was violated several times. That's not what you...
Oh my God!
I mean, we're looking at between type 2 diabetes and pre-diabetes, we're looking at about half the country.
Yeah.
No!
Welcome to the Dr. Frank and Steve podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is the Dr. Frank and Steve podcast. I'm your host, Frank Williams. This is a co-host, Dr. Steve Snodgrass. Today we're going to be covering basically what most Americans, doesn't matter your profession, seem to be struggling with at some point or another, and it's becoming more chronic as time goes by, which is healthy sleeping habits. So without further ado, and I will chime in as always, and Steve and I will banter back and forth. And if you have questions, feel free to always, click the link or go on to our contact information, and we will be able to give you, we don't give you medical advice, but we can give you a little guidance as to where maybe you can find some. Along with that, I will put a link on for where you can get some of the healthy sleeping, breathing patterns and exercises and little courses on that also. So, and that's one of the things we suggest people kind of read through and kind of familiarize themselves with, so that they know they can usually find something that's triggering that insomnia or sleeping, if it's outside of medical, that is. So without further ado, I'll turn it over to Steve.
Here we go. This is a topic near and dear to my heart because I describe myself as having insomnia since birth, because I just did not take naps, and I just never have required much sleep at all. And one time, as we discussed, surgery was a good profession for me, because many times the ER doctor would call in the middle of the night. He's like, "I'm sorry to wake you up, but we got this gunshot wound and this kind of thing." He's like, "Well, you didn't wake me up. I'm just sitting here waiting for you because I knew you were going to call." But there was one time where we operated, except for a bathroom break here and there, 67 straight hours, and it was nonstop. It was really nonstop. But I was good until I put in my last stitch, and I said, well, I think I've had enough, and just went home after that, and kind of still couldn't go to sleep. And so it's a topic that's near and dear to my heart, and I sympathize with anybody who has that problem. But older adults, and that's classified as 60 years or more. But here we go. Now you're in that category, Francois. But who? So what I did was I looked at the Journal of the American Medical Association, and they've got kind of a sleep's greatest hits of the literature that actually is just started from the beginning of this year, back a year and a half ago. But I just went through that. It was 55 pages of links to articles. So I went and just went through the ones that I felt like, well, those are topics that are commonsensical, really, but they have been through clinical trials and proven. So it's not like we're just saying this. It's like we're going from actual trials and studies that prove what we say is true. So I just wanted to share those. There's 10 major points, and we'll go through them. But when you're older, you have a higher risk of depression, and it can be associated. There's a fairly strong association with insomnia and depression, especially in older people. And treatment of insomnia can be used to help prevent depression. And there's a lot of people that are 60 and above on antidepressants and all that sort of thing, as we all know. And so if cognitive and behavioral therapy have been shown to work very well in preventing insomnia without the use of drugs like Valium and things like that. So, which contribute to dementia and those kinds of ongoing problems, and how many people are affected by depression and dementia, that sort of thing. That's, in this country, it's a significant number. So sleep, we know, has major consequences for physical and emotional well-being. And they had like an article about iatrogenic sleep disruption, which just means that's the doctor that's causing it. But there's studies out now saying, and I've been in the hospital pretty recently, and I was like not left alone. It was like, you're constantly getting vital signs, that sort of thing. And I kind of needed it at the time. But they're saying that patients who are stable and they've been in the hospital and they remain stable, whatever that is by definition by the doctors taking care of them, to try to eliminate middle of the night vital signs and that sort of thing. Because it's kind of standard that, that you get vital signs done in the middle of the night and disrupts sleep. So what's on your mind?
I just thought when you first said that, you were going to say, I was in the hospital and I was violated several times. That's not what you said.
Yeah, kind of. Well, that too. That too. I've
You know
got
what you're in there for.
Yeah, I've got the needle marks to prove it. But But I do think that that's an important thing, because if you've got a patient that's stable and you can leave them alone in the middle of the night, it's kind of nice.
Oh yeah, they're going to get rest because they're going to be wore out.
Yeah, and I think it helps in the healing process. And the third topic is I go more in depth in that, because it's on obstructive sleep apnea. And how many times have you seen like a CPAP commercial on TV? I mean, it's like,
well, if it's not a drug commercial, which I consider CPAP part of that, it's some type of big pharma commercial or healthcare or CPAP. Like you said, that's about all you see.
Yeah.
Weight loss drugs. I won't name the brands, but it's outrageous, because you're like, do I really need to see this at dinner time? Not you should be watching TV anyway, or I'm trying to enjoy something with the family, and that's what you get. The big pharma and the medical, which we're only, like, we've done this on a podcast, so we're only one of about 2 or 3 countries that actually allow that. Hopefully, with the new HHS secretary coming in, that's a major factor, is to try and get those things removed.
I think it's a boring kind of life if your highlight is cleaning your CPAP machine. I'm just saying, it's an observation.
Yes.
Okay. But anyway, it causes interrupted breathing while you sleep, and it's estimated that 22 million Americans suffer from sleep apnea. But what I thought was something that was very important, that 80% of people with sleep apnea remain undiagnosed.
Wow.
So that's pretty significant.
It is.
So how many people would that be? And it's caused by, a lot of times when you're asleep, the muscles in the neck and throat, they'll relax, and they can kind of block the flow of oxygen while you're sleeping to your lungs. And so people that do have sleep apnea, they will experience frequent waking and coughing and low oxygen levels. And the symptoms can negatively affect your quality of life, for sure, because if you wake up multiple times during the night, you'll be tired during the day, and a lot of times people complain of morning headaches associated with that. And also you can increase the risk of abnormal heart rhythms, heart attack, high blood pressure, complications of surgery, and stroke. So the ramifications of that problem are very significant. But I again, one of the take-home messages on that is 80% of the people remain undiagnosed. And if you're diagnosed and then you start treating it, you can perhaps prevent some of these other major medical problems that are associated with it, which not only, again, the cost of healthcare, physical, mental, financial, and look at, if people get diagnosed, how they could improve their quality of life, plus the financial situation as well for the country. But lifestyle changes like avoiding alcohol, losing weight, stopping smoking can help alleviate your symptoms. And sleeping on your back is not good, so if you can avoid that, that's a good thing. But one of the things too that I would like to say, and we discuss it all the time, the difference between ignorant and stupid. You know, if you've never been exposed to anything and you've got this behavior, and you don't know what can happen because of it, I mean, that's ignorance.
Right.
But stupid is like when you smoke, it's just a stupid habit.
Yep.
It's a stupid habit that will kill you, and it will make you suffer a lot along the way. So I think that people don't realize how many kinds of cancers smoking is associated with, and like bladder cancer and things like that. And they're kind of going like, well, how could that be? Well, it is. It affects everything.
Yes.
And
we call that ignorant in the hood, not ignorant. So, and that means that it's not that you're ignorant of the information, you just choose to ignore it.
yeah, I mean, and it's really, one thing that, this is a little side note, but this is something that I saw, and I feel like I've kind of seen a little bit of everything that you can believe, and a lot of things you can't. But I had a patient of mine that he came in with a skin lesion, and it just looked like his regular skin, but it was like just a mound, like it was a mass, but it was very strange because it was almost like half of a tennis ball size. And he had no symptoms whatsoever except this mass on his back. And I was like, he's got no symptoms whatsoever. He's like 50 some odd years old. And so I did what's called basically an incisional biopsy because the thing was so big. I was like, if we take it off, here, it's going to be a major surgery to take that thing off. And so what I did was I just took several little incisional biopsies of it in different places. And it came back as, now this was a skin thing, and it comes back metastatic lung cancer. And, he smoked, but he never had a cough, never had any kind of what's called hemoptysis, which is bloody cough.
Yeah.
Never had any symptoms, and then gets a chest x-ray, and he just got this big lung mass. And he ended up dying from metastatic lung cancer. But the presenting symptoms, it was a skin lesion.
Wow.
So it's pretty remarkable what you see
I'll bet.
in medicine. And medications that will lessen the drive to breathe will worsen the sleep apnea. Opioids, certain sleep medications, benzodiazepines, that would be like Valium, Xanax, Halcyon.
You say those can make it worse?
Those can make it worse because they'll relax the muscles, that sort of thing, and they can decrease the drive to breathe.
So you're saying it may help with the resting as far as sleeping, but as far as the body and oxygenization, I said that correct. Okay.
You're
Just
good.
like the usual.
You got it.
That can actually do more harm to your body.
Yes,
Because of that effect,
yes.
not getting the proper oxygen levels.
Yeah, it can decrease what's called the respiratory drive and that sort of thing. And also it can be a muscle relaxant, which is part of the problem. Your muscles are relaxing and cover your airway, that you got a problem. But the other thing too that seems to be a major problem is that benzodiazepine, the drug class, is that is being abused more by like teenagers, kids, that sort of thing, and they're getting into their parents' drug supply and taking these drugs and overdosing and dying. And so a word of caution out there is like, if you have any kids around, no matter what the age, just like you can't let them have access to those drugs. And I know that's said a lot, but it seems like people aren't paying that much attention to it.
Because everybody wants, and sometimes they do it, everybody wants to be the next YouTube star, the next Flip star, the next, which is another platform, TikTok, you name it. So that's kind of crazy in itself. I'm gonna not make the comment I was gonna make because my wife watches these podcasts sometimes and I want to be punched in the brain. So
Well, now you got me curious, so.
I will say this is a general rule. The more natural, relaxed things you can do in the evening before bedtime, the more it'll totally relax your body without medications. I'm gonna say that just say that from an Italian standpoint.
Okay. All right. Well,
Your doctor, I don't think will put that on a prescription pad, but you never know.
well, Richard Pryor addressed that in one of his videos and all that
Mhm.
sort of thing. And he said, like, after the event you were talking about, if whoever you're with wants to talk about computer components, then you're not finished. So there you go. But he said, because that should put you to sleep.
Yes.
So I think it's called Le Petit Mort, is what, that's like kind of like the official title of that. Le Petit Mort, like little death. So
We call it more.
the next one that they discuss, which is, again, you see this all the time, is melatonin. Melatonin
that's
is one of the key hormones that will govern circadian rhythms, and circadian rhythms are just, your sleep-wake cycle, body temperature,
So
hormone.
is melatonin actually good or bad?
Well,
Very popular.
It's extremely popular, and it's over-the-counter kind of thing, and it's not regulated by
Right.
FDA. And this one study showed that they did melatonin levels in these supplements, and they tested them, and they found that the content of melatonin was 478% higher than the label content. So,
Wow, you would think they were trying to make it lower to make it, more cost effective for themselves.
well, it's just, the thing of it is, it's like, it's just not, it's not governed during
Right.
manufacturing and all that sort of thing, and the FDA does not regulate that, and so they're not knowing what's going in there.
Kind of like, and I know this is off topic, but kind of like we're discussing the other night about tattoos and the ink that goes into tattoos, and how a couple of the guys said that, yeah, they'd gotten an infection from their tattoo, and I said, because the ink isn't regulated.
Yeah.
There's nobody that regulates those inks, and they said, well, there's just the ink in there, and I said, let me pull some information up for you. And after that, they're like, well, I don't think I'll get a tattoo for a while.
I think they should have watched the podcast.
Yes, that's what I told them.
Yeah, exactly. But it's one of those things where, I had said this before, but at the request of the U.S. Olympics, they asked me to evaluate some of these supplements that the Olympic athletes were taking, and it was involving creatine, a muscle builder kind of thing. And so anyway, I told them to go get different samples from different parts of the country, literally coast to coast, and see what they're taking, and then take it to a lab. And then they found, I think it was 16 banned substances in it. And so those athletes were taking that thinking like, well, there's nothing banned here. And so I'm safe. But then they would take those drugs, and if they got
Oh, it can be
tested,
bad for you. And you know, back before, it's been almost 20 years now, I had open heart surgery. I take care of myself, so God bless me, I'm in real good shape now. But the issue is, back when I was competing for a Mr. Fitness contest, which was a national contest, because I had taken the local one and stuff, and and I got about fitness in close now.
you came in second to Arnold, didn't you?
Yeah, it wasn't that. It was Mr. Fitness, so you were ripped. I had my, my body index was down to about, just right at 3% body fat. And so, which was, a hospital was actually, you had to be part of it. Hospital actually had to do all the measurements. But I was taking pure creatine under the tongue.
Yeah.
And my cardiologist later in life said, it's one of the reasons you could probably take, because of what that does to the actual arteries and the veins and everything when you take that, but nobody knew that, because it wasn't just creatine in that.
Well, it's, I think, again, a take-home message is like, when you're getting supplements, it needs to be from somebody that's, it's like GMP, good manufacturing process.
Right.
You know, it needs to be from a very credible source. And, but melatonin is found to be, it's not as good as what people think it is. And especially in kids, there's no studies in the long-term safety of melatonin in children. And for the most part, children are not lacking melatonin, older people are. And so children, in my opinion, children should not be receiving melatonin.
Yeah, like the twins take melatonin, and I know my wife does. I mean, they're going to be seeing your wife, Mary Lee, who's I guess a master pharmacist, apothecarist and stuff, who, you know, does that. What does she recommend, or does she individualize those?
Oh,
And is that what you
yeah.
should do, individualize per person, for their unique, you know, body structure and use case, versus just buying melatonin, you know, at Walmart or, you know, one of the vitamin stores, or like the Vitamin Shop, or any of those, or, you know, GNC.
Well, I think that, you know, she individualizes each case for sure, but the whole thing about melatonin, and I don't know if she really recommends melatonin. She's never talked to me about that. And, you know, like, I have issues with sleeping, and I could do very well, but I had a period of time there, it was about a 5 or 6 day period, and I was sleeping about maybe an hour to an hour and a half every 3 days. It was pretty bad. It was pretty bad. And
You should go to work for Trump.
well, I mean,
About his Trump, his sleeping pattern.
well, I get along well without sleep, obviously, because I mean, I had to operate many times with obvious sleep deprivation, and you know, it's not an excuse. You just got to do what you have to do. But after like about 5 days of that, I went and talked with a good friend of mine who's also an internist, and he and I were talking about it. He said, like, well, we need to stop the cycle of that, and at least get you a night, maybe every 3 nights, where you're sleeping a little bit anyway. And so he put me on some medication to do that. But the thing was, he said, like, if you go like 5 or 6 days like that, you can have a psychotic break that's permanent. So that's how important all of this. And I'm going through this right now with my grandson, who's a little over a year, but he's going through a thing where they're trying to get him to go to bed earlier, and I know this sounds kind of ridiculous that it's even a talking point, but they recommend the earlier bedtimes for children as something like that, instead of like some of these long naps during the day or whatever. They just recommend an earlier bedtime, and that it supports growth and cognitive development, mental well-being, and metabolic health. And so that's a simple, pragmatic way to help solve some sleep issues in kids, that just put them to bed early and get them in that habit. So also along those lines, creating a safe sleep environment for an infant will lead to consistent sleep practices, and can reduce the risk of sleep-related infant death. And share a bed, or share a room, not a bed, for an infant, because co-sleeping will increase the risk of suffocation, and put an infant in a separate sleep space.
Yeah, SIDS. I think on
Yes.
this.
Well, it's
Sudden infant death.
on this thing, you know, and I saw a case of this, and it's just kind of gut wrenching.
Oh, yeah.
But like a mother fell asleep, and the infant was in her bed, and she rolled over on the kid and suffocated it. And so it's like, it's gone, it's dead, and you know, the kid's dead, and you'll never get over that.
No.
No, you'll never get over that. But I've seen it, and it's just an absolute catastrophe. And so placing an infant on their back can help from naps and at night, and it's not really safe to put an infant on, you know, their side of their stomach to sleep, because they can basically suffocate themselves. So a firm, flat sleep surface is good, like cribs or bassinets. Everybody knows that, but like I say,
That made it pay attention.
yeah, that's
Like
written.
properly burrito wrapping them.
Absolutely. And another one that is interesting to me is that people who sleep less than 6 hours, they had a higher risk of developing type 2 diabetes compared to people who slept 7 to 8 hours per night. And the increased risk was associated with a sleep disturbance no matter what the person ate. If they followed a strict diabetic diet, if they slept less, their diabetes was not as controlled.
Oh, wow.
So, and type 2 diabetes, we know is like, we're looking at between type 2 diabetes and pre-diabetes, we're looking at about half the country.
Yeah.
About 150 million people.
Yep.
And it's an absolute disaster. And shorter sleep duration across childhood can be a risk for the development of psychosis in adulthood. So all of those kinds of things are important for parents to understand, like how well their child is sleeping. And so it's inflammation, chronic inflammation, they think is one of those causes. And that's gonna go back to some of these things about make America healthy again, and these processed foods and all that sort of thing. So it's all interrelated to one another because those kinds of food stimulate inflammation in the body. And the other thing too, that sleep disturbances and clinical sleep disorders, like the first point, they're associated strongly with all-cause dementia. And dementia is just, and other neurodegenerative disorders, but dementia, especially as baby boomers like us are aging, you don't want to be having any kind of dementia problems or anything like that. So sleep is absolutely vital for existence. Yes. So those were the 10 major points that they kind of stressed, and I wanted to pass that along to people that listen to us.
Good. Yeah, and I noticed coming from like a veteran and for the military and first responders, it's in the military, it's more like about over half the people on active duty, even veterans, reserves, tend to have sleep disorders. And there's a couple of specific ones that are related to the military, directly. But again, like Steve said, because you're always jacked up, ready to go, you're always, just like in law enforcement, I used to work, the 3 to 11 shift or 4 to midnight on rotations, and you can't just go home and just fall asleep, I wasn't too bad at it, but there'd be times if you were involved in a shooting or a fight or, a really busy night and things were just going, by the time you got home, you were still jacked up for a couple hours.
Oh, yeah.
And you had to get up the next day and like normal, kids off to school, wife off work, whatever it would be. And so that tends to, exacerbate the conditions for a lot of those first responders. It says that for like first responders themselves, it's over 31% usually experience some type of, sleeping disorder. Insomnia, it's probably about 28 to 30% currently. This is all NIH statistics. They have what they call restless leg syndrome. I don't even know what that is. I do. It's about 2% of the responders or first responders experience that. Police officers can be some of the worst because that's a wide range depending on what area you're in, how active you are, what your city or town or whatever it is, because those percentages range from 23% all the way up to almost 80% of those police officers, or most police officers, report having poor sleep quality.
Yeah.
You don't need a guy with a gun or a girl with a gun having a bad attitude. You just need to get a good night's sleep.
And the thing of it is, like, if you think that you're gonna get called, like, if you're, like for me, and it's the same like, in the military and police, like, if you think that you're gonna get called and you're just basically waiting for the call,
Exactly.
I mean,
Yeah, when I was
there's no
on
risk there.
rotation on my ATAC team, anti-terrorist tactical alert team, we wore those big pagers, and you only had a half hour to, once it beeped, to be on site, ready to go wherever they needed you, and the deploy and do whatever. So when you were on that, you would try and get your rest, and you actually had to, with a couple of the other people, you had to rotate your sleep patterns and hope that during your time while they're sleeping, which is the way we did it. You didn't get buzzed, so you're on no sleep, like Kramer in the Seinfeld episodes, or Jerry when they switched apartments. But those, like you said, those lack of sleep can affect your body in horrible ways. Obesity in both adults and children. Diabetes, like you said, cardiovascular disease, hypertension, anxiety is a big one. It can set up depressed moods. It can lead to increased alcohol use, all of that. So to go over some areas that I want to cover briefly is like what can help some of your sleeping habits. Well, obviously the first thing, if you're having some issues, you need to get medically checked out and get, and make sure that everything's going okay functionally within your body, health-wise. And then, it doesn't necessarily mean you have to leave, because usually a doctor will be able to find the time, well, this might be something where you're stressing. Maybe you need to see a psychologist or a psychiatrist, or, maybe I need to go out and call the guys in the white coats to come and visit you. But if pretty much all that's ruled out or something minor, a lot of people are going to tell you there are some things you can do to kind of get yourself out of the pattern of, limiting your sleep. A big one is, and this information's out there and it gets pushed all the time, is, try and keep your room somewhat dark when you're going to sleep. Keep your room somewhat cool. Some people love to have heat. My father loves his room like a sauna at night, but at 96, he's kind of earned that privilege.
Whatever works.
That's right. Keep your room very quiet. There are some people who like to sleep with a little ambient noise, and I don't think there's anything wrong with that myself, but I'm one of those people. You want to make your bed comfortable. Make sure that you got springs poking up if you're lucky enough you have a mattress. To wherever you're sleeping is a comfortable area. And then reserve your bed for sleeping only. So many Gen Z, Gen X, baby boomers, so many people, especially if they're on TikTok, Facebook, Flip, Instagram, Twitter. If you see a little video, a lot of times they're sitting on their bed, they're doing something in that bedroom, on that bed, or they're trying to go viral for whatever reason. But what most experts agree on is that you need to keep your bed for just sleeping and resting. That means don't lay in the bed using your tablet, using your phone. I'm going to say majority of Americans are guilty of that. Don't use any type of laptops or anything. Even if you're reading a book, that's okay, but it tells you that try and limit that to a certain extent, because if you get used to doing something other than sleeping, your body kind of adjusts to that, and it knows, and it can break up your sleep patterns basically. And then make sure you establish good sleeping habits, like Steve said, for young kids. I can almost see that where kids, they're not really cranky or tired during the day, forcing them to nap, and then they're going to be rested by the time you try and put them to bed, and they're going to jack right back up and be awake. So anything you can do to get a healthy sleeping pattern, and then set that sleeping pattern every night. And by no means am I a psychologist or a psychiatrist or a therapist. I might have to use one, but I'm not one. And just for disclaimer, I don't use one. I have friends that are, and students, but there's no hope, as they said anyway. So so you want to make sure you keep your sleeping patterns adjusted to where they're correct. And sometimes weekday sleeping patterns are different than weekend sleeping patterns, but you want to keep them as similar as possible if you can. You always want to avoid caffeine late in the evening, nicotine, and alcohol before bed. Those substances, they can mess with your sleep pretty bad. It talks about managing stress, breathing exercises, and we have some healthy breathing courses, and breathing pattern exercises that I will include the link to where you can go and do those. Those come out of my background from studying the samurai arts for over 5 decades, and it really helps you to lower your blood pressure, lower down your heart rate, and can put you in a very relaxed state, almost like a meditative state, and which will help you sleep a lot better.
Well, one thing that I was talking to this friend of mine who's an internist, he said, now this is one of those probably better to do when I say rather than when I do, but he asked me, he said, like, well, do you want to undergo these formal sleep studies? And I said, so like, that's one of those things where they're going to put a bunch of electrodes and all this kind of stuff on your head and watch you and all that sort of thing. I said, I would never, I said, if I can't go to sleep under normal circumstances, I sure am not going to go to sleep wired up, and have people like observing me and all this other kind of stuff. It's so like, I'm going to sit there and just look at you while you're looking at me.
Yeah.
So I don't think it would work for me.
It'll look like a horror movie.
Yeah, I just seem like, and all those kinds of things, to me, they may work on other people, but I'm not gonna put myself in that category. I know it's bad to say, but I feel like that would not work for me. Because if I can't sleep when I'm perfectly relaxed, what are you gonna do with all those wires all over you and people watching? I don't think that would be for me, but that's just me.
And like Steve was saying, if you visit with a specialist or somebody that's for healthy sleeping patterns and health overall, whether it's a specialized pharmacist, whether it's a specialized nutritionist, whoever that might be, make sure that they're well versed with the different vitamins and supplements that you should be taking. Some may recommend something, maybe it doesn't work for your body that way. B12, iron, all those different supplements, you want to make sure that you're getting the proper amount of those, because they can affect how your body functions. And going, and letting that progress over weeks, months, years, which it does for a lot of people, your body as you age, as Steve mentioned 4 times, I marked down being 60 and over. Thank you. But it can lead to some health issues as you get older. And that's one thing about, I'll say it again, my father-in-law, God bless him, is going to be 96 here in just a few weeks. And one thing that I know he's always done, when he put his head down at night, he was out, and he was out hard until the next morning. And he said he's always been able to sleep all the way through the night. I could sleep all the way through the night unless I get woken up or disturbed by somebody, but I'm a pretty sound sleeper. I don't have to get up and go to the restroom or do any of that stuff, thank goodness. So
I wake up, 2 or 3 times a night, every night, pretty much. And it's just like, if I get like 4 to 5 hours a night, that is pretty good for me.
Wow.
If I get I can't even remember any time in my life getting 8 hours of sleep. I can't remember one single time. And so, but if I got 6, it's like, if I get 6 hours of sleep, I'm like the Tasmanian devil,
You're strutting, huh?
I've really got
peacocking around.
I've got some energy, But then again, on that thing I was talking about earlier about all the electrodes and all that sort of thing, if your doctor recommends that, then by all means, go for it.
Yeah, because we have a massive sleep center here in our area, and I've known 2 or 3 people that went there and have they've been able to correct their sleeping patterns. So they do work. It doesn't work for everybody, but they do work.
And for me, I just don't want to. I'm like, if I get 4 to 5, I'm good. I've gone many nights where I get 1 to 2.
Right.
And can function just fine. But after about a week of that, you want a night where I get 4 or 5 hours.
Right.
So I can go a pretty long period of time just getting a couple, but after a certain prolonged period of time of that, I need to get put down for a while.
And
Yeah.
And so, like Steve was saying, Things at night also you don't want to use, and everybody sometimes has their movie night. You don't want to watch a big action flick and then go straight to bed, because that's going to have your, you know, just like working out, your endorphins are going to release in your brain, and you're going to be all hyped up and jacked up, and you know, that can make that worse. But
And one of the worst things that, according to the studies that I read for kids, and I didn't know, I mean, it's obvious that they're going to do it, but playing a video game in bed. You know, like they're going to bed
because of all those pixels going into your brain.
Yeah.
The brain, they're so sharp with 4K and all the rest of them are out there now. You know, the high definition. The brain, from some of the things I was reading, I'm sure it's the same stuff. The brain, especially for a developing brain, until they're in their, you know, mid-20s or whatever, especially for males, they can't process all that. They're seeing it, they're playing it, they're doing it, but the brain's having a time trying to process all those little pixels that are coming through that screen into your eyes, into your brain. So it kind of overwires it and overwhelms it.
and they're so attracted to it. I mean, like
addicted.
Like my grandson, again, when we're doing FaceTime and everything, he sees that screen, and he's just like a magnet. He just goes right for it, and it's the bright and shiny object. You know, it's like the first thing they're going to go for.
Right.
So they're trying to really limit his activity, his screen activity, to like not much. I mean, the kid's 1 year old, for God's sake. But you know, so
I just tell them, like most people, not to interrupt, but you know, if you need something to watch at night to help you sleep, just watch one of our podcasts.
It works.
Yeah. You get information. You say, "Oh, that was good."
Yeah, and there you go. But I think that for me, it's like I know that what I did when they said like he's really attracted to the screens and all that sort of thing. Even though he's one, I got him like the other day. I just got him. I'm going to start like his own book club, and so I sent him. My wife and I sent him 16 of the Dr. Seuss greatest hits.
And you get the Dolly Parton book too. She'll send him a book a month until he's like 18.
Yeah, well, actually, I looked into that, and it wasn't available in the Chicago area where they live. But I looked into it, but I said, like, well, if I can't get that, I'm going to start him on
you have it sent to your house? Just Melatonin?
I kind of like Dr. Seuss myself.
Yeah, I do too.
I really do. And probably one of my favorites, which this has nothing to do with anything, but it doesn't have to, right?
Right.
But I particularly like Go Dogs Go and Oh, the Places You'll Go. And I think that's,
we have the whole collection. I love Dr. Seuss.
Yeah, he's great. And I thought, like, you know, just to mess with the kid, I thought like I could put like, put his name on it, and I would sign it Dr. Seuss.
You know, we see it in the mall and everywhere. If you want to talk about how you're stressing your kid out like that for healthy sleeping patterns, I watch people going through the mall, and I don't really ever go to the mall, but when I do go to the mall or go out shopping, because I like to buy a lot of fresh items when I prepare meals and stuff, you just see somebody with a kid in a stroller, they're in the cart, this kid's 1 year old, maybe a little older, around it. Automatically, if the kid starts I'll see the mom put something more, or you automatically, they're going by watching, like that's their babysitter. They're watching monster trucks, they're watching cartoon this, Paw Patrol, whatever it might be, SpongeBob. They got them on something to keep them occupied, and I'm like, well, that's only going to occupy them for a certain time, but then they're like glued to it, these kids.
Oh yeah, and the other thing too is like this is a great medical term that's used all the time, because I've heard people talk about it, but for the most part, people that are outside of the medical profession don't really know about it, but it's like it's part of the whole vernacular, if you will. It's like if you go into, especially like the intensive care unit or something like that, to where like, you know, all the rooms have big glass windows where you can see everybody for obvious reasons. It's the intensive care unit. But if you're sleeping with your mouth open, it's called the O sign. And if you're sleeping with your mouth open and your tongue out, that's called the Q sign. That's just a little tidbit of medical information there for you. That's slightly.
I'm writing it down.
So when I just say, I remember a lot of times if I had patients in the intensive care unit, I would see them at least 2 to 3 times a day, because, I really wanted to make sure, and especially before I went home, I wanted to make sure they were all good. And then if I had somebody who was really, really sick or just in the immediate post-op phase, I would always, in addition to the rounds of 2 to 3 times a day, before I went to bed, I would call and talk to the nurse and say like, well, give me their vitals, tell me how they're doing. And they would just say like, oh, he's doing fine. As a matter of fact, he's got an O sign. He's doing, he's stable and he's sleeping and everything's good. So that just, allowed me to get a lot of uninterrupted nights from phone calls, because I would make the phone call and see how they're doing. Yeah, I was just going for all you, if you're a resident or intern or med student or anything like that, this is a good tip. It's like, don't remove things at night. Like if they've got a nasogastric tube or whatever, don't take that out at night. Because if you take it out at night and they get in trouble, you gotta go put it back in. So, you take it out, if you're gonna take out the NG tube, you take it out in the morning and then you just see how they do through the day. Same thing with the Foley catheter. Just don't take it out at night. Just leave it alone. Leave everything alone at night that you can.
Yeah.
And then like,
which makes sense, yeah.
Yeah, and then it does, but it's like, I used to do it all the time, because I would cover for other doctors when I was on call for them. And they would be like, well, I'm not gonna be here tomorrow, so I'll just, I'll remove that tube tonight. And so they remove the tube, and then I will get the phone call, and so it's like, don't remove things or don't add things at night if you can keep from it. Do it like 6, 7 o'clock in the morning. And then that way you got the whole day to see how they do, because that's a very frustrating thing for somebody to get a tube removed, and then you've got to go replace it in the middle of the night when all you had to do was just leave it alone.
Right.
And that's a major point. It's a major point. And it really, for people out there that are in the medical profession, nurses, doctors, whatever you are, that is a great rule of thumb to follow.
It is, sounds like it anyway.
And I did that from the beginning. And like people would say like, let's take out that NG tube tonight. I'm like, patient's fine with it. He's had it for like 3 days or something. He'll do fine through the night. We'll get it out tomorrow morning and then just see how they do. And then by that time, by lunchtime or something, they're doing good, you start on a clear liquid diet or something like that. So you just, that natural progression, but you don't want to do that and then get yourself in trouble in the middle of the night, because there's not as many people there and you just got issues in nights and weekends a lot of times when everything's not fully staffed and there's problems. So, that's a nice little health tip. So, there you go.
Well, we hope you enjoyed this podcast. Again, we will be doing a podcast next week. We'll be doing some more updates on our blockchain projects and everything. So, and how we plan on and how we're moving forward with some influencers and the launch date and everything. So, until then, stay healthy, stay safe.
See you later. Thanks.
Thanks for listening to the Dr. Frank and Steve podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.